You can tell us what you guys have been up to. Dr. Sunil, you could begin what you've been up to over the last few years and what your passions are.
So for the last, well, I've been on this conference for the last 4 years, which I appreciate, always coming back. But, we run the largest plant-based practice here in the Southwest in Albuquerque, House of Sanjevani Integrative Medicine Health and Lifestyle Center. I have a private practice. We've been working with integrative medicine, which is evidence-based, as most people know. And most people know that most of my patients are going to be traditional chronic disease patients. And then about 60% of our patients are cancer patients. And we've had great successes with improving outcomes of all sorts of reversing diseases and chronic conditions with looking at inflammation, immune system, and a variety of natural aspects of dietary and lifestyle practices to help our patients move forward.
Great, thank you. And Juliana, how about you?
I have been here too, and it's nice to be back and nice to see everyone. And I've been, really focusing on my private practice. I work with clients around the globe. I focus on doing lifestyle transformation, mostly lots of weight loss, chronic disease management and reversal, and, writing, social media, all the fun stuff, speaking around the world, all the good stuff, talking about plants.
All right, great. So let's go ahead and get it started. So I'm going to throw the first question over to you, Juliana. So your book promises weight loss for the last time. In your book, the Choose You Now diet. How is it different from other diets that tend to have yo-yo kind of results where people lose weight and then they end up putting it back on?
So I'm not a typical dietitian. I don't count, calculate, measure, or weigh. My role is, of course, we have nutrition and the actual diet parameters themselves, but I really like to focus on the humanity of the situation and how we are living in this crazy world where no matter what you want and what your intentions are, you're surrounded by constant temptation, constantly being bombarded by temptation, and the normalization. I call it the modern day trifecta of overconsumption. And we've got, our biology is built to want to eat as much calorie as possible to survive in times of scarcity. But the second part of that trifecta is that we are constantly being bombarded by these tempting messages and everyone else is eating it. And then the normalization of overeating and overeating junk food. And of course, it's really hard to lose weight. It's really a really toxic food environment. So I help my clients. We have all the science and the nutrition parts, but I use plant-based nutrition. I use time-restricted eating, but I most importantly focus on the behavioral strategies for changing your relationship with food. And so the whole idea is, how do you navigate these crazy social situations? How do you navigate life? Because there's always going to be something that pops up that makes it a little bit more challenging. And so once you learn, I always tell my clients I want them to have a PhD in weight loss, but most importantly, they're also aggregating a PhD in weight loss maintenance in the process of understanding why they make the decisions that they make towards food. So it's mostly psychology, sociology, and behavioral, and dealing with everyone around you so that you can do what you want to do and stand in your truth and be able to accomplish the goals that you want to accomplish.
Okay. And Dr. Sunil, what do you suggest for people to live a lifestyle where they're not fluctuating in weight, which is so common? People take these short-term strategies to lose weight and they end up putting more weight on than they started off with.
Yeah. So when when we look at our patients, so taking where Julianna's going with her clients correctly, we kind of go a little bit more into the physiological and anatomical, immunological side of looking at, as a physician, looking at then dysfunctions, imbalances, right? So we can then test the nutrition. We can actually look at the microbiome. So in addition to seeing like the environmental lifestyle stressors that which she mentions it's absolutely true. It's bombarding and confusing for the client, even when they want to lose weight. It's because everything is promoting them not to lose weight, or they're now selling you a drug just to say, just take this and not do anything, right? But for what we like to look at is we look at the pain points of our patients. So we look at, what are the triggers of inflammation coming into the diet. Even from a plant-based food, you can still have inflammatory triggers. So once we start looking at reversing these diseases, then the weight loss just starts to come off, because that's kind of the added benefit of getting healthier. And so I look at it like, how do we fill in the gaps? Because a lot of people want a quick fix, and she's absolutely right. There's a lot of psychology, a lot of sociology, a lot of environmental strategies that we have to develop, which we also explain and educate our patients. But then we can kind of look at certain other points where they might have all that support, but they're still having some pitfalls or some setbacks, and we're able to find those subtle setbacks or those little road bumps, and able to have a smoother ride or smoother forefront of getting them to where we need to get them.
Great, thank you. So, Juliana, the keto diet is extremely popular. I don't know why, but it is. And based on the best evidence, what are your concerns about its long-term health consequences?
It's a popular diet because people want to eat certain things, and that kind of gives them permission to eat as much, cheese and meat and all those like ooey gooey stuff that they've kind of been craving. But then, you can't avoid the truth, right? Like the fact is that you could lose weight on any diet. They've been shown you could do it with Twinkies, you could do it with any kind of food. And losing weight is not necessarily like so exciting. It's the fact that you could do it healthfully on a plant-based diet. And we know the science on eating high consumption of animal products shows increased risk factors for pretty much every disease across the spectrum. And so I have people that are recovering from a keto diet come to me, and I look at their labs, and it's exactly as we would predict from the literature. They're, elevated triglycerides and lipids, and like everything is so pathogenic that it's just exactly what we would expect. So you could do it, you could lose weight, but you still aren't going to be healthy. And the best thing about a whole food plant-based diet is you could be healthy and lose weight at the same time, and you can just extend your health span and longevity, and so you get the best of both worlds.
So now I'm going to ask you about somebody who's controversial, but I'm not talking about anything other than his diet and the diet of his wife and his daughter. So,
I know who you're going to say.
yeah, Peterson. Yes. So Jordan Peterson, has, I guess his daughter was had some chronic illness and was actually quite sick. She ended up going on an all meat diet. I think there's a little bit of salt. I forget, it's like one other thing that they put into their diet. And then I don't know what Jordan Peterson's issues were or his wife's issues, but they decided to follow suit and claim to have resounding effect. They're not selling anything. They're not selling any books on the diet. They don't have any sort of ulterior motive that I can tell. And assuming they are, really doing this diet, and they said they don't even like doing it, right? Because it's really hard. It's very boring. But they look vibrantly healthy. They're cognitively very sharp, and they claim that their medical issues that pushed them to go into this direction are gone. Yeah, are resolved. So what are your thoughts on that? Is that likely? Is it possible? Obviously, probably not good for everybody, but why would this be?
Okay, I'm obsessed and fascinated by nutrition and health and all this. So
Yes.
I was like, wow. And I listened to him speak. And so I'm always like, what could this possibly be? Like, you have to, because again, you have to look at anecdote and story very objectively with a lot of skepticism.
Mm-hmm.
So first of all, there was a cancer scare since said died in the mom. So we don't know, and you never know. Cancer is a much more complicated mechanism, etiology and all that. But my hypothesis, without knowing them or seeing their lab work, because we don't really know what's going on. I haven't looked at their labs or known any details of their actual prognoses and their journeys. My hypothesis is if you're eating a standard Western diet full of sugars and all these other, fried foods and all these other things, lots of flours and all these other things that are pro-inflammatory, because the daughter had a autoimmune disease. That's what it started with, I think.
Yes.
And so with if you start from there and you eliminate a lot of that stuff, that's my hypothesis. And maybe they eliminate all these other things that were pro-inflammatory, and so they're able to sustain this right now. But we haven't looked at long-term labs. If it were my clients, I would want to see their before and after labs. I'd want to track them. I'd want to see. But if you're simplifying your diet that much, that's a step in the right direction. And again, you could lose weight, and losing weight helps improve outcomes of different health circumstances. So like, even if you're just losing that weight and you're eliminating all these other foods, that could be an amelioration from where they started. So it's compared to what is a question not asked often enough. And I can say that generally speaking, but again, I haven't looked at them specifically. And I think it'll be interesting to see how it unfolds. I wish them the best. So it's interesting.
And Dr. Pai, your thoughts on a diet like that and the results that they claim to be seeing?
Well, it's just a claim, number one. It's not science. It's just an N of 3.
Agreed.
Right? So if someone's eating a pro-inflammatory diet, high in omega-6, high in oxidized cholesterol, little to no antioxidants, absolutely no phytonutrients, no fiber, increasing dysbiosis, increasing endotoxins, LPS, eating high HCAs, TMAOs, insulin growth factors, new 5GC, they are increasing their heme iron, they're increasing their insulin resistance, decreasing their metabolic resting rate, increasing their pesticides and bioaccumulation of toxins and even nanoplastics and stuff like that, which we now have data on. There's really no study that will show you know that eating an animal protein or eating animal proteins prevent or reverse or treat diseases.
Okay. Thank you.
Well, let's go on further.
Oh, go ahead.
Let's just say that there is no study.
Right.
Right. So is there, can this be a one-off? Sure. Would I recommend it? Heck no. But people are, this is America. They can do whatever they want, and people can promote whatever they want. But the idea is that, I'd put money on and say, well, where are these people in 5 years? Because I see patients every day, right? And I see patients who are on the carnivore diet. I see patients, and they come in, and I have patients between 30 and 35, had 4 of them in the last 2 years, coming in with stage 3 and stage 4 colon cancer. Right. So like that's the reality. Like we see more disease than people saying, oh, I'm free of disease. Right. But the media and everybody wants to spin this story of like, oh, I eat something. It's like that's not how science runs. That's not how really the data. If you look at large populations or even randomized controlled clinical trials. But again, that doesn't mean anything to most people who just want to believe what they want to believe. So like, buyer beware, just letting you know, like, people want to get health advice from, these random stories. And that's what gets, in the news, it gets us talking about, oh my God, I don't even want to give any attention to misinformation or bad information.
Sure. So, so Dr. Pai, can you elaborate on the 10-step guide mentioned in your book for reducing inflammation?
Yeah, so these are just some of the 10 steps, but it's really looking at an epigenetic approach, right? So we know that epigenetics is what we need to do in terms of turning our genes on and turning the genes that we don't want to turn on, turn off. Okay, so we want to always start off first eating a plant-based diet, whole foods if you can, plant-based diet, and also trying to look at shifting those to being more organic and kind of cleaning up the environment. We also want to then go to looking at testing and looking for triggers of inflammation. That is my specialty, and I wrote a book, An Inflammation Nation, as most of you know. And so we're looking at it, even if you do shift to a plant-based diet. So, some of these clients or some of these people who write these stories, they might have a lot of sensitivities. And so by them restricting their diet, they feel good. So understandably, there's a health benefit of removing certain foods, but you can't be removing all the foods. And even from a plant-based perspective, most of my patients who come in who are maybe not a plant-based person, they're eating a standard American diet or paleo keto diet, they will have inflammatory triggers, but not just only on an animal protein. They can have inflammatory triggers, either immune from an immediate perspective within an hour, up to 4 days later as a delayed for plant-based foods as well. So we really want to look at an individual and saying like, what is coming in that's triggering inflammation? We want to look at then detoxification, and not talking about just a cleanse or things that people see on the health, on the Instagram and these little programs. We're looking at detoxification markers. We're looking at the microbiome, looking at, the amount of fiber and short chain fatty acids. And we're looking at how the body, biochemically and systematically and functionally actually work at, clearing toxins, not just, take a product. And you'll see a lot of people just, hawking product and selling programs. We want people to stop smoking, and now there's a big increase of vaping, which I wrote about, which there's a lot of dangers, and now that's come full front in the information. We also want to look at decreasing the use of non-steroidal anti-inflammatories, because a lot of people, 30% of the population is taking an ibuprofen, Motrin, Advil, Aleve, Celebrex every day. And if you don't know the dangers of those, I definitely recommend reading my book so you can understand what a black box warning is. Then we move to like giving anti-inflammatories, natural anti-inflammatories in our patients, in addition to the anti-inflammatory diet that we then kind of find the triggers and targets of. And that is looking at using the natural anti-inflammatory that is the flagship, called Bosmeric SR, which we have now hundreds of thousands of patients now in the last 16 years now using worldwide, and that's the strongest natural anti-inflammatory. I can talk about it a little bit later. We look at then strengthening the immune system by natural agents, even just checking vitamin D levels, to actually giving things like Glucan 300 that are patented and clinically tested, but looking at natural killer cell functioning, lowering inflammation. We also then want to make sure our patients have good, healthy blood glucose levels, their reduction of their salts and sugar intakes. We want to look at stress reduction, right? And also doing balancing and strengthening and like practices like yoga. And then we finally all look at rounding out social interaction and sense of purposes. These are all the things like when you look at blue zones, right? Simply that's kind of come back into the vogue now, is looking at, what are the healthiest people living the longest do. And that's kind of what you really want to be kind of following, that, because that's the proof in the pudding, not just 3 people who've restricted their diet, for example.
Right. So Juliana, in the context of Candida overgrowth and its association with cognitive symptoms such as brain fog, can you share holistic strategies for effective management and eradication of this condition?
Not my department.
No. How
No.
about you, Doc? How about you?
Yeah. So first and foremost, you have to test. So the challenge that you'll see in the natural world or the alternative world, particularly on social media and everything else like this, is that everybody will claim a symptom and they'll say, well, that's Candida. And that was like the big thing in the 80s. Now it's still, again, it's coming back in vogue. We now understand that you can have dysbiosis of a variety of different kind of mycology, different kind of funguses, different kind of series or species of bacteria, which is another section, right? So a lot of times people say, oh, it sounds like Candida, because it does people that have overgrowth of mycology species, right? Fungal and Candida and otherwise, and yeast of otherwise that are in the gut. It can cause these, brain inflammation. It can cause all sorts of symptoms, GI symptoms, inflammatory conditions, etc. However, that's just one set, right? So there's also bacteria that can do that. So when people take a cleanse and they take an anti-candidal product, if they don't know that they actually have Candida, because most of them now don't actually when we test them, they actually have a bacterial overgrowth, for example, right? And the symptoms are the same, but the treatment is different because you have to give an antimicrobial. If it's a fungus, you have an antifungal. Naturally, in my perspective, I don't need to get. Some people can take prescriptions, but I prefer natural. And if it's a bacterial overgrowth, there's certain natural agents that are this. But when people just randomly take these things, which they do all the time, they're actually causing more dysfunction in the microbiome. And we understand that it's because we test that in our clients. And we can see people who do cleanses and do colonics and take all these programs, and they actually come in and their microbiome is completely dysfunctional. And so we have to rebuild that. So I'm really cautious now. There is products that can be given, but now here's the interesting thing that we have, that when we do testing, we go further because we look at the sensitivities and the resistance to natural therapies or prescriptions. So a lot of people go, oh, I've been taking this, oregano oil or berberine or uva ursi, or I'm taking this product that my chiropractor, my naturopath, or I put my hand on this machine and it told me something in the back of a health store. We go further than that. We want to look at, like, in your gut that they grow in microbiology, what actually does work and what doesn't work, and be surprised that how many natural things are now becoming resistant because people take things all the time. People take things for cleanses just too much. Like, they may not even have the symptom, but they think that's what it is. And then it's like taking amoxicillin, thinking you have an infection when you don't. And then most people say, I wouldn't take amoxicillin, I wouldn't take an antibiotic, for months, but they take a Candida cleanse for weeks, right? So what we like to look at is be really evidence-based and targeted, so that we know, like, if that patient has a problem, then what is that? And then individualize that treatment rather than doing the shotgun approach. Even with natural therapies, that's what's happening way too much, in my opinion, is that more people are now coming in, doing these things, thinking it is. And then when the data shows that it's not, then it's like they've caused more harm than good. Now, for those people who actually have the problem, then we want to get it more targeted with less side effects and then get rid of that problem and then restore it. When people sell a program, in my opinion, and they say, oh, you got to do a Candida cleanse or a cleanse every 3 months, that means they don't understand physiology, anatomy, immunology, and how to restore someone's health. Because once you solve the problem, you're pretty much done with it. You don't have to keep doing it. That just means people are selling you dysfunctional information to sell you a program.
Thank you. So, Juliana, you've authored many articles on plant-based nutrition for healthcare professionals. What are the most critical messages you wish to convey to the medical community?
Oh, so many things. I guess my call to action is to remember that food is so important and to incorporate dietary strategies, or at least offer the suggestion to their patients that it doesn't have to be pharmaceutical only, and that there is, like, extraordinary evidence of reversal of these major chronic conditions with dietary practice and lifestyle medicine. And so just having that information and knowing how powerful diet is, that's my number one call to action to the healthcare professionals that I was writing to and speaking to.